Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we help you to get the facts straight on the Ebola virus. It has claimed more than 4,000 lives and infected more than 8,300 people. Ebola continues its deadly trek across West Africa, and this week, concern mounted as the United States confirmed its first Ebola death and Spain reported its first 2 cases. Right behind them, Australia, Macedonia, and Brazil were investigating suspected infections. But even faster than the spread of the virus are rumors about how Ebola is contracted. There is no need to panic if you arm yourself with the right information. Here are the facts as outlined by the World Health Organization and the U.S. Centers for Disease Control and Prevention. Ebola is spread through direct contact, through broken skin or mucous membranes, for example, the eyes, nose, or mouth, with blood or body fluids, urine, saliva, sweat, feces, vomit, breast milk, and semen of a person who is sick with Ebola. Objects like needles that have been contaminated with the virus, infected animals. It is not usually transmitted through just casual contact, such as shaking hands or brushing past someone. The Ebola virus can survive outside the body, so coming into direct contact with infected bodily fluids on surfaces such as bedding, clothing, or furniture, and then touching your eyes or mouth can spread the disease. The CDC explains that Ebola on surfaces, such as doorknobs and countertops, can survive for several hours. However, the virus in body fluids, such as blood, can survive up to several days at room temperature. Ebola is not an airborne disease like influenza or chicken pox, and the WHO categorically says reports suggesting that Ebola has mutated and become airborne are false. That also essentially means air travel is low risk for Ebola transmission. The World Health Agency says on the small chance that someone on the plane is sick with Ebola, the likelihood of other passengers and crew having contact with their body fluids is even smaller. It explains that when someone is sick with Ebola, they are so unwell that they cannot travel. The virus only appears in the bodily fluids of an infected person after they already have symptoms, so a carrier cannot unknowingly spread it before they feel sick. According to the CDC, the time from exposure to when the signs or symptoms of the disease appear, that is, the incubation period, is 2 to 21 days, but the average time is 8 to 10 days. So how do you know if you're infected? The initial symptoms are fever, fatigue, muscle soreness, and a sore throat. Later on, patients will experience vomiting, diarrhea, a rash, kidney and liver failure, as well as internal and external bleeding. And how should you protect yourself? The best defense is to wash your hands thoroughly after any public outings, whether you touch handrails or greet other people with a handshake. Wherever possible, do not bring your hands into contact with your mouth without washing them thoroughly first. Be extremely careful when caring for sick relatives, dispose of tissues in sealed plastic bags, and wear gloves if you have to deal with soiled bed sheets or clothing.